Welcome back to Doc's VA Podcast, everyone. I'm excited for today. We're going to be looking at the U.S. healthcare system and specifically how those healthcare virtual assistants are changing things up. And, we've got some really interesting facts to unpack. Like, did you know that almost 70% of hospitals in the U.S. are nonprofit?
Wow, I did not.
Yeah, surprising, right?
Yeah.
And get this, a huge chunk of what we spend on healthcare actually goes to just running the system, not even the actual medical care itself. It's a wild world out there. U.S. healthcare, it's this crazy mix of public and private organizations all working together. Sometimes they're even competing, but it's all to try and provide healthcare services to everyone. So we've got our providers, right? That's our hospitals, clinics, long-term care facilities, all that. And then on the other side, we've got our payers, the ones footing the bill, our private insurance companies, and then the government programs, Medicare, Medicaid, CHIP, the whole gang.
That's one of the things that makes the U.S. system so different from a lot of other developed countries.
Right.
We don't have universal single-payer healthcare like some other places. It's this really intricate mix of public and private financing that you just don't see everywhere.
Totally. And that's actually what leads to those fun facts I mentioned earlier. Like, we've got tons of nonprofit hospitals, which is great, but then you look at nursing homes, and a lot of those are for-profit. So it really is a pretty diverse landscape.
It is, and that's what makes it so complex. And with complexity comes, challenges.
Oh, yeah, for sure. Probably the biggest challenge we hear about all the time is that we don't have universal coverage in the U.S.
Right.
And it's a whole other can of worms, right?
Oh, yeah.
I mean, it affects how people get care, how healthy they are overall. Tons of huge implications.
It does, and it's something we're still figuring out as a nation.
For sure. And then tied to that is the whole cost of healthcare thing.
Oh, yeah.
Get this. The U.S. spends more per person on healthcare than any other developed country.
Really?
Yeah. Almost double what some of those high-income countries spend. But here's the thing. Even though we're spending all this money, our health outcomes don't always measure up.
It's a real head-scratcher.
It really is. It's almost like a paradox.
Yeah.
I mean, we're known for all this incredible medical innovation, but then so many people still struggle to get basic care.
It's true.
It's mind-boggling. And then on top of all that, our providers are drowning in administrative work. Paperwork, billing codes, dealing with insurance companies. It's overwhelming, right?
I can imagine.
No wonder so many people are burning out.
Yeah, all that administrative stuff takes so much time and energy away from actually caring for patients.
Absolutely.
It's like trying to run a marathon with a backpack full of rocks.
Perfect analogy.
And, this is where our healthcare virtual assistants or VAs are starting to step in. They could really help us manage all of these growing demands.
That's what we've been hearing more and more about. And it's not just scheduling appointments anymore either. VAs are taking on way more complex tasks these days.
They are, and there are a few reasons for that. First, there's just so much administrative work that providers are desperate for help.
All right.
And second, the technology's finally caught up.
It seems like it changes every day.
I know, it's amazing. Now we've got these VAs that can seamlessly integrate with healthcare platforms and handle really sophisticated stuff.
Wow.
And then the third reason is patients themselves.
Makes sense.
They want more convenient access to information and services.
24/7, on demand.
Exactly. And VAs can help with that too.
It's like the perfect storm. Everyone needs them. And now they're actually possible.
Exactly.
So what are some examples of these complex tasks that VAs are tackling these days? Beyond, the scheduling and stuff.
Well, we're seeing VAs manage those electronic health records.
Oh, yeah, those are huge.
Which can save clinicians a ton of time.
Oh, for sure.
And they can streamline billing processes.
So less errors, getting paid faster.
You got it. And they can even provide some basic medical information directly to patients, answering common questions, helping them navigate the system, which can be pretty confusing, let's be honest.
Oh, absolutely.
It's amazing to see how much this technology is already doing.
It really is. But I imagine there are also concerns that come along with it.
Yeah.
Like, what about data privacy? And how do we know these VAs are giving patients accurate information?
Those are definitely valid concerns, especially as VAs become more common.
Right.
Making sure data is kept private and information is accurate is super important. And as VAs take on even more responsibility, we're going to need some thoughtful regulations to make sure they're being used safely and responsibly.
It's all about finding that balance.
Right.
We want to encourage innovation, but we also have to protect patients and the integrity of healthcare.
Absolutely. And to do that well, everyone needs to be involved. Patients, providers, the people developing the technology, the regulators, everyone needs a seat at the table so we can shape the future of healthcare together.
And figure out where VAs fit into all of it.
Exactly. Yeah, it really is fascinating to think about where all of this is heading. As these healthcare VAs keep getting more advanced, more capable, we have to start thinking about how those expanded roles could actually change the whole dynamic between patients and their doctors.
It's true. Like, will we get to a point where VAs are the main point of contact for patients? Handling everything from booking appointments to even giving some basic medical advice.
It's definitely possible. And if that does happen, we have to be really careful. We need to make sure these VIs are designed and implemented in a way that doesn't lose that essential human touch in healthcare.
So what do you mean by that? Like preserving the human element?
Well, think about what makes a good doctor-patient relationship work. It goes beyond just clinical information, right? It's about empathy. It's about trust. It's about truly understanding each patient's individual needs and concerns.
Yeah.
And those are qualities that are hard to replicate with technology.
No matter how fancy it gets.
Exactly.
So how do we prevent VAs from becoming just another impersonal layer of bureaucracy? Something that could actually make healthcare feel even more transactional.
That's the million-dollar question, and there's no easy answer. But one thing that's going to be crucial is training. We need to be training these VAs not just to be efficient and accurate,
Right.
but also to be sensitive, to be responsive to the emotional needs of patients.
So almost like giving them emotional intelligence.
Yeah, in a way. We need to teach these systems how to recognize cues, understand nuances in communication, and respond appropriately to all sorts of different situations.
It's not just about spitting out information.
Exactly. It's about delivering that information with empathy and in a way that builds a supportive relationship.
And that's where human oversight becomes even more important, right?
Yeah.
We can't just hand over the reins to the machines and call it a day.
Oh, absolutely not. Human clinicians are always going to be essential, especially when it comes to those really complex parts of medicine, like diagnosing conditions, creating treatment plans, addressing the unique needs of every single patient. VAs can be amazing tools, but they should never replace the expertise and judgment of a trained medical professional.
So it sounds like the best case scenario is this kind of collaborative model where VAs are working in partnership with human clinicians to provide the best possible care.
Exactly. Think of it as a team effort. The VAs can handle the routine stuff, freeing up clinicians to focus on the more complex issues. And that also allows those clinicians to spend more quality time with their patients.
Which is what everybody wants.
Exactly.
And from the patient's perspective, this collaboration could mean greater convenience, faster access to information, and more personalized care.
Right. And it could even lead to better outcomes. Imagine a VA that's constantly monitoring your vital signs remotely, and it can alert your doctor if something seems off. Or a VA that's proactively answering your questions about your medications, helping you stay on track with your treatment plan.
That's amazing. It's
Yeah.
really incredible to think about how quickly healthcare is evolving.
It really is an exciting time, but like with any new technology, especially one that has such a big impact on people's lives, we need to proceed carefully, thoughtfully, and ethically.
I completely agree. We need to make sure these advancements are used responsibly, with patient well-being and safety always coming first. But we also have to acknowledge that there are potential risks here.
Of course, no technology is perfect. One concern is the potential for bias. If we're training these VAs on data that reflects existing inequalities in healthcare, they could actually end up perpetuating or even making those disparities worse.
So, for example, if a VA is mainly trained on data from patients with a certain socioeconomic background, it might not be as effective at serving patients from different backgrounds.
Exactly. It highlights how important it is to use diverse and representative data to train these systems. We need to make sure VAs are designed to be inclusive and equitable in the way they deliver care.
That makes sense. And then beyond the data itself, there's the issue of access. Not everyone has equal access to technology or even the comfort level to use it, so we have to make sure the shift toward a more VA-driven healthcare system doesn't leave anyone behind.
That's a really important point. There will always be a need for human interaction and support in healthcare, especially for those vulnerable populations who might face barriers to accessing or using technology.
So it seems like finding the right balance is key here. Technology can definitely make healthcare better in all kinds of amazing ways, but it can't replace that human touch entirely.
I think that's a great way to put it. It's not about technology versus human care. It's about finding ways for technology and human care to work together effectively. The key is to have a flexible system that can adapt to individual needs and preferences.
Yeah, it really feels like we're on the edge of something brand new in healthcare, where technology plays a much bigger role, but hopefully not at the expense of the human side of things.
Absolutely, I agree. It's not about replacing doctors and nurses with algorithms and data, right? It's about using technology to actually make those human interactions even more powerful, even more effective.
So as we figure out how to make this all work, what are some of the things we need to be really careful about to make sure we're using these technologies responsibly?
Well, one thing that's absolutely crucial is transparency. Patients have to understand how these VAs are being used in their care. They need to know what data is being collected, how it's being used to make decisions about their health. It's all about building trust.
That makes a lot of sense. And what about from the provider's perspective? How do we make sure that doctors and nurses are comfortable working with these VAs and that they see them as helpful tools, not as some kind of threat to their own expertise?
That's where training and education come in. We need to be training clinicians not just on the technical side of things, like how to actually use the VAs,
Right.
but also on the ethical considerations that come along with it. They need to feel confident that they can oversee these systems, step in when necessary.
So it's not just about the how-to, it's about the should we.
Exactly.
It's about fostering that mindset of collaboration, of shared responsibility between humans and technology. And of course, on the patient side, there are those big concerns about privacy and security. People need to feel confident that their data is being handled responsibly, that their privacy is protected. Especially with all the data breaches we hear about these days, I can see why people would be hesitant to trust a machine with their health information.
Oh, absolutely. And that's why having really robust security measures in place is non-negotiable. We need strong encryption protocols, access controls, auditing mechanisms, all of that to safeguard patient data. And we need to be upfront with patients about what we're doing to protect their information so they can feel confident about using these systems.
It sounds like we've got a lot of work to do, but also a lot of potential to really make a difference.
I think so too. I'm actually really optimistic about all of this. We're at such a pivotal moment in healthcare, and I think with careful planning, with thoughtful implementation, we can really harness the power of technology to create a healthcare system that's more efficient, more equitable, more patient-centered.
That's a great way to put it. I'm excited to see what the future holds. Thanks so much for joining us today and sharing all of your insights.
It's been my pleasure. And to everyone listening, we encourage you to stay informed, stay engaged in this important conversation. The future of healthcare is in our hands, and together we can make it even better.
That's a great message to end on. Thanks for listening, everyone. We'll be back next time with another look at the world of healthcare and technology. Until then, stay curious, stay well.